Yemen was once dominating global incense and spice trade. Today, it is struggling with one of the world's most severe food security and nutrition crises. Yemen's long-standing role in regional trade, historically important ports and hinterland links for incense and spices, contrasts sharply with its current humanitarian collapse. Years of conflict, economic decline, and regional spillovers have ruined everything. Large shares of the population face acute food insecurity. Malnutrition rates remain extremely high among young children. Mothers' and households' coping capacity is exhausted. Nutrition crisis. According to a World Bank Group press release published on June 30th, 2026, over 2.2 million children under 5 and 1.3 million pregnant and breastfeeding women were malnourished in mid-2026. Reduced dietary diversity, deteriorating health services, and declining preventive nutrition interventions have increased risks of severe acute malnutrition and long-term developmental harm. Around 18.3 million people faced acute food insecurity in mid-2026, with national poverty estimated at about 74% and nearly half of children under 5 stunted. Similarly, a press release published on June 3, 2026 by UNICEF reports, in government-controlled areas, Integrated Food Security Phase Classification (IPC) analysis, 2026, estimated roughly 47% of the population facing high acute food insecurity and 1.4 to 1.8 million people in emergency (IPC Phase 4) during 2026 lean periods. Worsening economy. According World Bank Group press release published on May 21, 2026, Yemen's real GDP contracted by 1.5% in 2025 and was projected to contract another 0.5% in 2026. Fiscal revenues fell to about 5.6% of GDP, constraining government spending on salaries, subsidies, and essential services. Humanitarian financing also fell sharply. UN response funding coverage dropped to 28% of needs in 2025, from 56.5% in 2024. The release further blamed disrupted incomes and markets for the crisis. Oil export blockades, weak remittances, reduced exports, and limited access to finance have cut household income. High import dependence means rising global prices. Shipping disruptions and higher transport costs quickly translate into higher food prices and reduced purchasing power. Why the former spice trade king is struggling with humanitarian emergency. Conflict and fragmentation. Years of war fragmented governance, closed or damaged ports and markets, and disrupted agricultural production and input supply chains that historically underpinned local economies. Macro and fiscal collapse. Falling revenues and external financing reduced state capacity to pay salaries, maintain subsidies, and import essential food and fuel, all crucial to food access for urban and rural households. Aid shortfalls and conditionality. Large reductions in humanitarian funding left critical programs under-resourced just when needs rose. Fewer therapeutic and preventive nutrition services, less food assistance added to the woe. Regional risk spillovers. Escalation of regional conflicts in 2025 to 26 increased shipping costs, supply chain risks, and global price volatility, amplifying food price inflation in an import-dependent country. Impacts on communities and children. Acute hunger and malnutrition. Large numbers of households are adopting negative coping strategies, skipping meals, selling assets, child labor. While malnutrition among children, pregnant and breastfeeding women undermines survival and long-term human capital. Service disruption. Damage to and closure of schools and health facilities have cut access to essential nutrition, vaccination, wash, and psychosocial services. Protection risks. Food insecurity increases vulnerability to child labor, early marriage, recruitment by armed groups, and exposure to explosive remnants of war. Rural livelihoods at risk. Around 60% of households rely partly on agriculture. Higher input costs, climate shocks, and market disruption are driving declines in production, increasing demand for emergency agricultural assistance. Current responses and limitations. World Bank and donors. The World Bank approved a $100 million IDA grant, Cash for Nutrition and Livelihoods, to reach 1.8 million people with cash, nutrition support, and link beneficiaries to savings groups and digital microwork opportunities for youth. The program prioritizes the first 1,000 days and includes civil registration support to improve access to services. Humanitarian agencies, WFP, FAO, UNICEF and others scale food assistance, therapeutic feeding, nutrition screening and WASH interventions where funding permits. Gaps. Funding shortfalls, insecurity, fragmented governance and logistical barriers limit coverage and sustainability. Cash assistance can be undermined by market inflation if supply constraints persist. Large-scale clearance of explosive remnants and rehabilitation of services remain underfunded.